Let's move on to the question number 21. Here we have what is the rhythm shown in the ECG below. So here in this ECG, we can see that in this ECG, so when I'd like to read the ECG, so you have to be systematic in the reading of the ECG. So here in this ECG, it's apparent what is called this sawtooth appearance. This sawtooth appearance is very typical for one of the common supraventricular arrhythmia. It's called atrial flutter. So again, so here in lead 3 is very apparent, and we can see it is flutter wave. It's called the flutter wave. It's called F capital. It's called F capital. These F capital waves or a flutter wave represent or it is unique for atrial flutter. So we have two kind or two types, or we have more than two types of supraventricular arrhythmias. One of these group, it is atrial fibrillation and atrial flutter. So the focus of arrhythmogenic focus in the cases of atrial flutter or atrial fibrillation, it represent above the AV node, and the atrium will be not weak enough to cause atrial fibrillation. In the case of atrial fibrillation, the atrium will be like this. It's very small, very tiny, and very slight contraction in the atrium. In the atrial flutter cases, no, the contraction will be a little bit stronger, but not. It can't reach into the normal atrial contraction. The normal atrial contraction should be like this, and in the atrial flutter, it will be like this. In the atrial fibrillation, it is very small, tiny fibrillation or fibrillatory contraction. So this is the difference between the normal contraction and atrial fibrillation and atrial flutter. In atrial flutter, it is characterized by flutter wave, which is sawtooth appearance of the contraction of the atrium, which is represented here. And the QRS, it's going to be normal QRS, which is narrow QRS, as we can see here. The QRS is normal here. All of these QRS are normal. And in terms of the rhythm, it could be irregular and it could be regular. Comparing to atrial fibrillation, it's almost always irregular. But atrial flutter, it can be regular and it can be irregular. So let's move on to the so here we have the option. Here we have atrial fibrillation, we have atrial flutter, we have normal sinus rhythm, and we have sinus tachycardia, and we have Wolff-Parkinson-White syndrome or Wolff-White-Parkinson syndrome. So this is the most likely here. The answer is atrial flutter. So you have to know the most common type of arrhythmia, the ECG finding for most common type of arrhythmia, like atrial flutter, atrial fibrillation, ventricular fibrillation, ventricular tachycardia, ST elevation abnormality like ST elevation MI, or ischemic changes like ST depression or T-wave inversion. You have to get all of these finding in the ECG quickly, especially in the MCQs exam for your preparation. So let's move on to the next question. So the next question here, we have question number 22. A 23-year-old student present to the emergency department with severe headache. So here we have severe headache and photophobia. These findings suggestive of CNS infection like meningitis or encephalitis. So initial CT brain is normal. So CT brain is normal. So lumbar puncture is carried out. So here we have the sample 1, we have sample 2, and we have sample 3. Sample 1, the red cell count is 100, then in the sample 2 become 52 and then become 0. This decrease in the amount of red blood cell in the samples, in the CSF samples, indicate traumatic TAB or traumatic lumbar puncture. So white cell count, it is persistent and it's continuous high in range of between 14,000 to 15,000 or 15,600, which is very high. Protein here in the sample 3, because sample 3 usually it's used for cytology, it is 62. It is mildly elevated because the normal it's between 15 and 45 milligram per deciliter. This is mildly elevated. And glucose, the normal serum glucose, it's 6 millimole, and in sample 3 it's 2. So it is reduced to glucose. So here we have reduced to glucose, mildly elevated protein, and markedly elevated white cell count, and no red blood cell. So what's the most likely diagnosis here? Here the answers we can see: aseptic meningitis. Aseptic meningitis, it's the same viral meningitis. Viral meningitis. Here we have viral meningitis. So here we can see aseptic meningitis is unlikely because there is 2 answers, which is viral meningitis. So it couldn't be the right answer here. Bacterial meningitis, this is the most likely diagnosis. Herpes encephalitis, it's unlikely here. And subarachnoid hemorrhage, it's unlikely because subarachnoid hemorrhage you will find in the sample 3, you will find red cell count in a significant amount. So this is the question number 22. So question number 23. Here we have 58-year-old woman. This woman presents with feeling short of breath, and this had been gradually worsening over the past year. You notice that she has symmetrical deforming polyarthropathy. Her medication include methotrexate, which she tell you this is for arthritis, and she's taking most likely nitrofurantoin, which takes to prevent urinary tract infection. So an arterial blood gas measurement on room air shows pH 7.47. This is represent alkalosis, or alkalemia, to be more accurate. It's called alkalemia rather than alkalosis, alkalemia. And PaO2 is 7.8 on room air. This is represent hypoxemia, and PaCO2 is 3. It is below the normal range, so this is represent respiratory alkalemia. So here we have this patient, she is hyperventilating. She is hyperventilating, and this represents the result of this. This is respiratory alkalemia, and bicarb HCO3 is 24, which is normal. So this is what's the most here. This is asking about what's the most accurate interpretation of this blood gas. So here we have alkalosis, and the CO2 is low, which represents respiratory alkalemia, and the PaO2 is low, hypoxemia. This represents respiratory failure, type 1 respiratory failure. So here we have type 1 respiratory failure with respiratory acidosis. This is wrong. Why? Because respiratory acidosis, usually it is associated with type 2 respiratory failure, not type 1. Therefore, this is wrong. Type 1 respiratory failure with respiratory acidosis, this is the most likely answer and the most correct answer. And type 2 respiratory failure, this is wrong. Why? Because this patient has type 1 respiratory failure, type 2 respiratory failure associated with metabolic acidosis, but this lady, she has no type 2 respiratory failure because she has no metabolic acidosis, because she had type 2 respiratory failure associated with respiratory acidosis. I'm sorry, here it's written as metabolic acidosis, and this is wrong. Why? Because the bicarb in this patient 24, which is normal. Answer D, a type 2 respiratory failure with respiratory acidosis is wrong. Why? Because the patient has respiratory alkalosis, not respiratory acidosis. And the last one is wrong because a type 2 respiratory failure with respiratory alkalosis, this is not type 2, this is type 1. So the answer most likely it is B. So question number 24. 70-year-old man present to emergency department after head injury. On review, he is confused. Confused, it will take on the GCS score, in the GCS score, because this question is asking about the GCS glaucoma scale. So confused, it will take verbal response of 4. Verbal response of 4 points. His eye are opening spontaneously. This will take in the eye response as 4 as well. And so he won't follow command. He withdraws from painful stimuli. Withdraw, it will take as well motor of 4. So it's 4, 4, and 4. This represents 12. So the most likely answer is 12. So the correct answer is 12 here. So question 25, 24-year-old female with history of Crohn's disease. Here we have history of Crohn's disease, presents with flare with acute exacerbation or flare up of Crohn's disease despite treatment with oral azathioprine. The decision is made to escalate her treatment to biologic therapy with infliximab. This is tumor necrosis factor inhibitors, infliximab, biological therapy. Which of the following investigation is essential to carry out prior to starting this patient on biological therapy? So the answer number 1, it is fecal calprotectin. Number B or the second answer, it is interferon gamma release assay. This is usually it's done, or it is a screening test for tuberculosis. And before starting biological therapy, we have to do routinely screening for tuberculosis and screening for silent like opportunistic infection, like for example PGB pneumonia, or so it's recommended to be done chest X-ray and to be done screening for tuberculosis. And the other things it's routinely done before starting biological therapy, it's hepatitis B, screening for silent hepatitis B surface antigen. So all of these should be done. Why? Because there is reported cases of activation of these silent infection, either tuberculosis or hepatitis B, in patients who started on this kind of biological therapy. So the correct answer here is 1, interferon gamma release assay for screening for tuberculosis. The other answers, they are wrong. MRI small bowel follow through, or thiopurine methyltransferase level, or vitamin D level. The correct answer here, it is B, for screening for tuberculosis. The next question I will discuss in the next video.